The pandemic has thrown up yet another challenge for the healthcare sector, with isolated cases of an unusual fungal infection being reported from some people being treated for the COVID-19. Mucormycosis, a rare fungal infection affecting immuno-compromised people, has been reported from among those battling and those recently recovered from COVID-19 in many parts of the country. Mucormycosis, previously called zygomycosis, is a serious but rare fungal infection caused by a group of moles called Mucormycetes. The fungal infection causes blindness, a serious illness, and even deaths in some cases. Instances of this rare fungal infection has been reported from many cities across India, including Ahmedabad, Bengaluru, Delhi, and several parts of Maharashtra.
Mucormycosis has been reported with increased incidence in this COVID outbreak now. And one of the reasons that being reported and people are scared of it is because it is associated with high risks of mortality or death, primarily because it tends to involve the brain, and then the treatment becomes quite difficult. So what we have to understand is that this mucormycosis or this fungal infection, it is an opportunistic infection, meaning it is very unlikely to infect and cause disease in somebody whose immune system is reasonably well functioning. Most people, even during the COVID, who have got this mucormycosis are those who are either uncontrolled diabetes or they have been treated with high dose steroids for a prolonged time. Steroids are widely used for management of COVID now, and we need to remember that this is a double-edged sword. Higher dose and longer duration of steroids will suppress your immunity and enable such fungi to cause invasive disease, which could affect the sinuses and the brain. The fungus is found all around us, so it is not a rare fungi to be found in environment. So reiterating the fact that it is a change or a fall in our immune function, either due to diseases like uncontrolled diabetes or due to use of medicines like high dose steroids, that this infection occurs or creates problem in these patients.
The disease is not new, but it is on rise among COVID-19 patients because the use of steroids elevates sugar level and some medicine suppresses the immunity of the patients. During the first wave of the COVID-19 pandemic, the fungal infection typically came to light a couple of weeks after the patients were discharged. But now, during the second wave, some patients are contracting this infection while undergoing the COVID-19 treatment. Meanwhile, the Union Health Ministry has taken note of increasing cases due to this fungal infection and informed that there is no big outbreak and constant monitoring is in place.